the Beers list, which would tell which ones are harmful for the elderly or harmful to be used on a long-term basis, but the Clozaril, of course, is harmful for anybody at any age if they get signs of infection. So your NCLEX-style questions will deal with what you are looking for. Well, you are looking for signs of infections. So if your patients or residents on these medicines get a sore throat, fevers, rashes, flu symptoms, you call the doctor and you tell them this was their last CBC, this was their last dose of Clozaril, and they will very quickly put 2 and 2 together and probably discontinue that medicine. Number 14, classification of medications that can cause tolerance and addiction is benzodiazepines, of course. I believe they call them on the street benzos. Number 15 was the same as number 3. So that concludes my comments that I feel like I need to make to help you do well on your final examination with psychopharmacology, and also to help you with your ATI examinations and NCLEX examinations. And now I'm going to turn to some points that I want to go over for in the ATI review book. I'm using the old edition, the 2011 edition 8.0. I have reviewed, by the way, briefly the new edition. I see very little changes in this. I'm working on getting printed up the new versions of the 2014 NCLEX test plan. We will go over that again in PVC 2, I expect, but in the meantime, don't hesitate to go to the National Council State Boards of Nursing, the acronym for that, .com, and go to NCLEX test plans. I look at the educator version. You will be a candidate, so you can look at those versions and see if they're any different. But I believe on my syllabus now for mental health, you have references to the PN test plan that will be the same on each test plan, the older version or the newer version that you will take. On page 155 for medications for anxiety disorders, chapter 18, the first thing I want to point out is Nardil. I don't pronounce the generic name too well, but that is a monoamine oxidase inhibitor that you might hear about more. So Nardil and Parnate, I believe, are the only two that I've heard about. You'll hear that more in the antidepressant chapter 2. CNS stimulants are mentioned here, like Ritalin and Concerta, but we will study those more in depth in the children's medication section. Zoloft is listed as an SSRI, and antihistamines such as Vistaril can also be used for anxiety, and Mrs. Camden was just telling me that some of her relatives use Vistaril for sleep now, and it works better than some of the other medications they had. A beta blocker like Inderal might even be used as a psychotropic medication, and Neurontin, which is an anticonvulsant, or was recently, now is used for pain, nerve pain, and may be used for anxiety also. Our first classification is the benzodiazepines, or as this text lists them, benzodiazepine sedative hypnotic anxiolytics. The first one is Valium that I commented on in the essential questions, and I went over this list already, so I won't go over there again, except to tell you that in our clinical this week at Appleton City, we had a gentleman admitted, and the report was very interesting in that some of his problems stemmed from alcoholism, and they thought he was overheated, and he may have been dehydrated and somewhat overheated, but he seemed to respond best to administration of Ativan for alcohol withdrawal. In my practice, I've seen Librium, which is in the same class here and listed in the text, given to help with delirium tremens of alcoholism, but the nurse down there, Karen, that we have worked with the most, she tells me that now, and the night nurse agreed, they use just Ativan in that category for DTs. At Pathways Substance Abuse Unit, they do not have medically supervised detoxification when people are coming off of alcohol for alcohol withdrawal. Some of the alcoholics that they get, they say, have been through it so much and they can stay pretty stable. If they're not stable, you could have them as a patient on medical unit in the hospital. On the next page, we need to look at the therapeutic uses here, and they do mention alcohol withdrawal and induction of anesthesia. Those are some other uses for these anti-anxiety drugs. You have a chart with side effects and nursing interventions and client educations. And then we're going to look at more depth in the contraindications or precautions. Diazepam or Valium, so commonly prescribed in the past, especially for women, is in pregnancy a category D, so they would want to avoid that. Benzodiazepines are classified under Schedule 4 of the Controlled Substance Act. This may have changed because they move those around some. Diazepam is contraindicated in clients with sleep apnea and or respiratory depression, and I bet you already thought of that because in our essential questions we already talked about them being central nervous system depressants and causing respiratory depression. Use diazepam cautiously in clients who have liver disease and or a history of substance abuse. So you know, after we studied my medication list in geriatrics, that with some medications we have to look for those liver enzymes. What are you going to see on those lab reports? Remember, ALT, sometimes SGOT, these different initials usually that are your liver enzymes. Medication and food interactions, CNS depressants with alcohol, of course, aren't going to work very well, and you can imagine that sometimes people do use alcohol with these sedative drugs to cause suicide. On the nursing administration, the second bullet here is important. Instruct your clients to taper the dose over several weeks when the medication is discontinued, and this is true for many psychotropic medications. The last two bullets, instruct the clients about the potential for dependency during and after treatment and to notify the provider if symptoms occur. Medications can relieve symptoms but does not take away the stressor. Psychotherapy is important in combination with the medication. So when we study what is effective, what helps mentally ill patients the most, including those with substance disorder, it is medications along with various kinds of psychotherapy, whether it's individual therapy, group therapy, family therapy, and play therapy, as some of you were studying for your research paper. Our next classification is atypical anxiolytics and non-barbiturate anxiolytics, and that's Buspar is the main one. So be sure and read through all that. I won't. On the next page, it expounds that these can be given for panic disorder, obsessive compulsive disorder, OCD, social anxiety disorder, and PTSD. And again, on the nursing administration, that second bullet is so important. Advise the clients that the effects do not occur immediately, and it may take a week to notice first therapeutic effects. And when they're desperately mentally ill, sometimes that seems like that takes a long time. Instruct clients that tolerance, dependence, or withdrawal symptoms should not occur with this medication. It's a newer one. The selective serotonin reuptake inhibitors, which the doctors may refer to as the SSRIs, are Paxil, Zoloft, Lexapro, Prozac, and Luvox. Oh, and I added to this list Paxil, and I believe that it is actually reviewed in this section. Yes, it is on the next, the third bullet down on the next category. Paroxetine and the therapeutic uses, it says it can help generalized anxiety disorder, GAD, panic disorder. It might help OCD, social anxiety disorder, PTSD. Then they have a chart with the medications, and these are SSRIs, the bottom of page 159, and I've written the brand name in there with that to help me study it. And so sertraline is Zoloft, the next one is Lexapro, fluoxetine is Prozac, Luvox, I'm not sure how to pronounce that one, is Luvox, the one that helped our patient, our resident, so much at Johnson County Care Center with his OCD, and sure enough, they've got Luvox listed as OCD. I really thought they would try him on Prozac, and I wasn't even familiar with Luvox, but sure enough, they did, and it helped him very, very much. On page 160, on the third classification of side effects, you'll see weight gain. So that basic nursing intervention or assessment is still very important in psychiatric nursing. Those people have to be weighed pretty frequently. Another assessment you'll make for folks taking this medicine is further down on the page, Bruxism. And how many of you would remember that from medical terminology? I don't think I went over it, but if you took a class somewhere else or perhaps in fundamentals you study it, that's the grinding and clenching of teeth. Bruxism, mostly just I think of it as a grinding of teeth during the sleep. And the night nurses will be reporting that perhaps at Royal Oaks if it would start. Paxil or paroxetine is also a pregnancy risk category D, so I did not really have to deal with that much, of course, at Johnson County Care Center, but I'm sure it's a consideration on the adolescent unit at Royal Oaks and even on their adult unit because they don't necessarily have elderly people there. So then you come to your application exercises. And I see on number 3 it says the correct answer is I will not take the medicine with grapefruit juice. And you know from pharmacology that that's not a good fluid to use for a lot of medicines to take them with. Now we move on to chapter 19 on page 165 in your ATI review book, the medications for depression, and skip down to tricyclic antidepressants, TCAs. Amitriptyline or Elavil, you've already studied on my medicine list. Do I take it for depression? No. My dosage is for nerve pain in my back. And I'm not sure it helps, but then the doctor said to continue it, at least help you sleep. And some of these medicines are giving just for sleep aids. Tofranil is in this category also, Sinequan, Aventil, and Sermontil, and I haven't seen that prescribed very much. On the next page, I want you to look at the anticholinergic effects, which I have certainly suffered with, the dry mouth, and you did do a good job in the geriatrics list for me at talking about interventions for xerostomia, and I do keep gum handy. Fluids handy at night. I have a bottle of water at my bedside. The blurred vision, if that were troublesome, I would think they would take them off of it. Photophobia, I haven't seen with that. Urinary hesitancy or retention, I haven't seen. The constipation is pretty common. And of course, if they have tachycardia, they might be doing an EKG. That's more with the antipsychotics that we'll see the use of EKGs. The next, after sedation, is another category with these drugs. Toxicity resulting in cholinergic blockade and cardiac toxicity evidenced by dysrhythmias, mental confusion, agitation, which are followed by seizures, coma, and possibly death. So that's how difficult these can be to manage, and they will be doing EKGs at Royal Oaks sometimes for people with these. They can have excess sweating with this also. These TCAs are also pregnancy category C. I can see young women taking these so that could be difficult. They include in the medications for depression, again, these SSRIs, Prozac, Celexa, Lexapro, Paxil, and Zoloft, which we studied in the last chapter. For depression or anxiety, they might be given. On page 168, I want to review there the Serotonin Syndrome. It's on the side, adverse effects in the 4th box. Serotonin Syndrome may begin 2 to 72 hours after the start of treatment. It may be lethal. Manifestations include, so this is what you watch for in the beginning, mental confusion or difficulty concentrating, agitation, fever, anxiety, hallucinations, hyperreflexia or incoordination, diaphoresis, and tremors. So hopefully you and the mental health technicians or the aides are watching these people carefully, especially when they first start the medication, and everything is reported so that you can head off any possible problems. And also, in the next category, they talk about the withdrawal syndrome, that you have to advise clients when you prescribe it, especially if they would be leaving a clinic with it, that they need to slowly taper off the medication if they decide to stop it. The next page talks about Prozac, fluoxetine, and the contraindications and precautions. I didn't write the brand name, but that's Prozac there they're talking about, and that's a pregnancy category C. Notice under interactions, we've got medication-food interactions, concurrent use with MAOIs, monoamine